Today, the topic of our Health Cafe is Women's Health Through Ages. We have a lineup of wonderful presenters who are going to talk about women's health as they proceed in their life journey. And our first speaker is Michelle. Michelle is a registered nurse with a passion for caring for babies, children, and families during their childbearing years. She has been privileged to work with the Radio Primary Care Network's Pregnancy and Babies program for the last 5 years, which augments her 20 years experience working in public health nursing. With approximately 50% of pregnancies being unplanned, it is important to talk about healthy lifestyle during the childbearing years that can improve healthy outcomes of pregnancy. Welcome, Michelle.
Thank you. Thank you for having us. So welcome to the preconception health component of the Women's Health Cafe. Today, we hope to increase your understanding about several healthy lifestyle principles to help prepare the mind and body for a healthy pregnancy, including the following topics: folic acid, healthy lifestyle, healthy eating, medications and other substances, choosing a healthcare provider, dental health, pap tests, vaccinations, mental health, and stress. First and foremost, it's a good idea to see your family doctor or primary healthcare provider before you start trying to get pregnant. You can discuss your nutrition, vitamin supplements, medications, and any other health concerns that could affect a pregnancy. Some people may need to consult with their specialist regarding any pre-existing medical conditions and or even an obstetrician gynecologist before trying to conceive a pregnancy. What is folic acid? Folic acid is sometimes interchanged with the term folate. It's a B9 vitamin supplement that is very important to the baby's early health and development. Some food sources of folate include fortified cereals, breads, pasta, whole grains, nuts, dark green vegetables, including beans, lentils, citrus fruits like oranges. It can be really hard to get the amount of folate that you need from food alone. So the best way to get enough is to combine folate foods and a folic acid supplement. Now, taking a folic acid supplement helps prevent some types of birth defects, and these are called neural tube defects. And that can happen when the fetal spinal column doesn't close completely, or if the brain or skull don't develop quite properly. Other deep birth defects can also be related to inadequate folic acid intake, and that includes things like cleft palate and even some heart defects as well. Now, most neural tube defects happen in the first 4 weeks of pregnancy, which is before a pregnancy is known. So with approximately 50% of pregnancies considered unplanned or unexpected, the standard recommendation for all women of childbearing age is to take 0.4 milligrams of folic acid per day during their entire reproductive years. Now, how much folic acid you need can differ depending on risk factors, which you can discuss with your health care provider or doctor if you're trying to conceive. And this is particularly important if you have a personal or family history of any birth defects, if you've been diagnosed with having type 1 or type 2 diabetes, if you have any conditions that affect the absorption of nutrients like Crohn's or colitis, or if you're taking any medications that are known to impact the metabolism of folic acid. The Canned Food Guide is a really good place to reference for healthy eating, and the guide recommends a couple of points. One is eating plenty of fruits and vegetables, whole grain foods, and protein foods, and try to choose protein foods that come from plants more often. It recommends choosing foods with healthy fats instead of saturated fat, limiting your intake of highly processed foods, and if you choose highly processed foods, to try to eat them less often and in smaller amounts. Try to prepare meals and snacks at home using ingredients that have little to no added salt, sugars, or saturated fat, and really try to make water your primary drink of choice. It's also good to note how and increase your awareness of how food marketing can impact your choices of food. You can easily find the Canned Food Guide online by a quick Google search. Healthy body weight is an important part too of preparing your body for pregnancy. Studies show that being either underweight or overweight can affect the likelihood of conception. And while body weight does influence fertility, problems with ovulation are most often caused by other factors. Now, there's no perfect way of defining healthy body weight because body frame and distribution of fat and muscle are different for every person. But the best tool we do have available for assessing body weight and health is the body mass index, which is also sometimes known as BMI. Now, being overweight may not increase your risk of having problems with ovulation, but obesity or a BMI of greater than 30 does increase the risk of having abnormal ovulation, which can increase decrease the ability to conceive. Now, obesity can just take it that much longer to get pregnant, and entering a pregnancy with a body mass index of 25 or higher can significantly increase the risk of complications in pregnancy. So even a small reduction or weight loss of body weight of 2 to 5% can really improve your chances of conceiving and of having a healthy pregnancy. Now, if there's underweight concerns or a BMI of 18.5 or lower, it can actually cause more difficulty in conception and does increase the risk of preterm birth. So gaining just a few pounds if you're underweight can make a difference in both a healthy outcome of pregnancy and chance of conception. As most of us know, exercise is a healthy part of a lifestyle. Now, we like to aim for or work towards at least 150 minutes of physical aerobic activity per week. And there's so many benefits to regular exercise for everybody, including weight management, improving your mental or physical overall health, reducing your stress hormone, which is called cortisol. It also increases the happy hormone, which are known as endorphins. It can boost your muscle and your heart, also known as cardiovascular strength, which is really needed to carry that extra baby weight during pregnancy. If you're taking medications or other substances prior to pregnancy, it's important to ask your healthcare provider about the safety of those medications or substances before you conceive or become pregnant. I'll briefly touch on a couple of these common questions. Is it safe to take medication when I'm trying to get pregnant? So some medications can harm a fetus in the very early stages of development. So it's important to review current medications with your healthcare provider or doctor before you become pregnant. They could advise a different dosage or add additional tests to monitor these effects of the medication, or they may advise you to stop taking it altogether. However, most times the treatment for a condition you have while trying to get pregnant or during pregnancy is exactly the same as the right treatment when you're not pregnant. So don't stop effective treatment or medication until you have discussed that in your plan with your doctor prior to becoming pregnant. Many people assume that natural herbal products are safer than prescription or over-the-counter medications, and this is actually false. Many natural products do not have or have not been tested for safety or effectiveness, and very few have been tested for safety during pregnancy. So it's important to discuss any natural or herbal remedies or supplements you're taking with your healthcare provider prior to pregnancy. And remember that just because something is sourced from nature does not indicate it's safe. For caffeine, caffeine can be safely consumed while you're trying to conceive or while preparing your body for pregnancy. The daily recommended maximum is 300 milligrams of caffeine, both prior to pregnancy and during pregnancy. So that's about 2 cups, small cups of coffee per day, or 5 to 6 cups of black tea per day. However, there is no known safe amount of alcohol for pregnancy or before pregnancy as you're trying to conceive. So avoiding alcohol is really the safest choice, because consumption of high amounts of alcohol does have serious effects on a developing baby, which can lead to fetal alcohol spectrum disorder. What about nicotine, cannabis, and street drugs? So we do know that smoking and vaping by either partner does reduce fertility. So quitting will really increase that chance of conceiving. Use during pregnancy does expose the baby to many toxic chemicals, and it's one of the most preventable causes of poor pregnancy outcome. Things like low birth weight, preterm birth, and stillbirth. Therefore, it's really best to quit before pregnancy. Remember to talk to your healthcare provider or your doctor in helping managing cravings or for more support with quitting. With cannabis, having legal access to cannabis now in Canada does not really at all mean that it's safe to use while pregnant or trying to conceive and or even breastfeeding. So as with alcohol or tobacco, cannabis use while trying to conceive should be avoided, including pregnancy, during pregnancy, and breastfeeding. Cannabis too, much like tobacco, can decrease fertility for both men and women. And if you're using it for medical purposes, please speak to your healthcare provider or doctor for safer alternatives. Using cannabis for morning sickness is not recommended. There's lots of chatter about that in the community often, because there's a lot more safer treatments that are highly recommended as opposed to cannabis. And that's because using cannabis during your pregnancy can result in your baby having a lower birth weight and has been shown to harm your child's brain development even before birth, which can lead to lasting effects throughout your child's life. Things like problems understanding or problems with learning, succeeding at school. It has been shown to link to hyperactivity, inattentiveness, impulsive behavior, and also increased risk of a depression or anxiety for that child. As with street drugs too, drugs are never safe for use, but they're particularly really unsafe too before and during pregnancy. And it's important to remember that it's never too late to reduce or eliminate consumption of alcohol, nicotine, cannabis, or street drugs, and just talk to your doctor or your healthcare provider for more support and a referral. Dental health. It's a really good idea to take care of your dental health problems before pregnancy. That's because women with poor dental hygiene are actually more likely to have a preterm delivery. So also in pregnancy, there can be a lot of bleeding and sensitivity and swelling of gums as a normal part of pregnancy. However, any bleeding of the gums should be investigated. It's really important too to continue with your routine, regular dental health checkups and cleanings during pregnancy, as almost all dental care is safe, including x-rays with proper shielding. For a pap test involves taking a sample of cells from the cervix, and it screens them for potentially cancerous cells. And then sadly, cervical cancer is the second most common cancer in women between the ages of 20 and 44. And all women should be screened for cervical cancer every 2-3 years, as soon as they're 21 and older. If you haven't had a pap test in the last couple of years, it's a good idea to get one before you try to start conceiving. And that way, if you have any abnormal cells, they can be treated before pregnancy and not need to be delayed treatment until after baby's born. Should I get vaccinated if I'm trying to conceive? If you're fully immunized before pregnancy, there's quite a few benefits. One, you are protecting yourself from disease. You're reducing pregnancy complications, and you're also passing along infections to your baby. It also has a great bonus of transferring protection to your baby until they're old enough to start having their own vaccinations. There are some vaccines that aren't recommended in pregnancy, so it's really a good idea to take a look at your immunization record before getting pregnant. And you can contact public health to ask them if you're up to date or if you need any boosters. Pregnancy and birth are very important life events that come with many physical, emotional, and relationship changes. And choosing a healthcare provider is a very important part of that process. Obstetricians, family doctors, midwives, and nurse practitioners are all qualified to provide care in pregnancy, and often they work in a team to care for the pregnant women. The choice of care is very individual. It's your own preference, and as well, looking at your own individual needs for medical concerns potentially that could dictate the best for your situation. And remember that all providers support and encourage normal birth and try to minimize interventions. It's very normal to have many emotions, and everyone feels worried, sad, or stressed at times. But if you're having trouble with your day-to-day life because of your emotions or your thoughts, your feelings, it could mean that your mental health may be affecting the quality of your life. If you're concerned about your worrying, sadness, or stress, or if you have questions about the medications you're already taking, please talk with your doctor or healthcare provider, as there's many things you can do to manage your mental health, and there are several community support and resources that can also be helpful. Very high levels of stress can affect your ability to conceive a baby. Signs that stress levels could be running quite high is maybe feeling irritable or easily frustrated, arguing more with your family, friends, or partner, using more tobacco, alcohol, drugs, or even food to cope, maybe even having difficulty sleeping. There are some healthier ways to cope with stress, including eating regular meals, which includes a healthy diet, drinking enough water, taking some time every day to relax, get enough sleep and rest, exercise regularly, and reach out to family and friends. You can even try practicing meditations or mindfulness. Now, getting help when you first notice symptoms of depression or anxiety is very important. And that's because depression or anxiety that lasts for a long time can have serious effects for you and your family, and it can actually be more harder to treat. So please remember to talk to your health provider if you're experiencing things like not wanting to spend time with family, maybe some mood swings, lack of interest in things you used to enjoy doing, if you're having any problems concentrating or with your memory, or if you have any changes in your eating habits, eating more or less than usual, if you're noticing any changes in personal hygiene and or sleep. Now, needing help does not mean that you're weak or that you won't be a good parent. It's just the earlier you ask for help, the sooner you're going to start feeling better. So where can you get help if you need? Talk to your doctor, your healthcare provider if you're concerned about your mental health or stress. You can also call the mental health helpline 24 hours a day, 7 days a week. You can also call Alberta HealthLink for support and resources in your community. If you're looking for even more one-on-one support, you can actually self-refer to the Red Deer Primary Care Network. Phone number and website are on the screen there. You can meet with myself. I'm one of the pregnancy and babies nurses, and I provide information for preconception, anything during pregnancy, and even into the first year postpartum. Answer general questions and inquiries, even about community services, and can help support you with tobacco reduction or cessation support. We also have many workshops as well and mental health counseling workshops that we have that may be interesting to you if you're looking at those healthy lifestyle principles for preconception, our health basics, anxiety to calm, mindfulness, drop-in, and we have a happiness basics program as well. Here's a short list for some good resources for additional information about preconception health. So I encourage you to check those out as well. Thank you so much for joining me today, and we'll just check in with Tatiana if there's any questions.
Thank you, Michelle, very much. We've been having anywhere between 7 and 5 live viewers, but no comments or questions yet. And I would like to move on to our next speaker and introduce Nicole Schmitt. Please welcome Nicole Schmitt. Nicole is a University of Alberta graduate and pelvic health physiotherapist and owner of Elle Physiotherapy and Pelvic Health. Nicole and her team care for those with pelvic pain, pelvic floor dysfunction, post-gynecological cancers, genitourinary symptoms of menopause, and prenatal and postpartum conditions. Nicole uses a whole person approach and believes education is key to empower women in their own health journeys. She and her husband live on a little farm on the edge of town with their 4 kids. Welcome, Nicole.
Thank you so much, Tatiana. Okay, so like Tatiana said, my name is Nicole, and I am a pelvic health physiotherapist. You might be sitting there and saying, a what? A physiotherapist for what? Although pelvic health physio is becoming more well known, there are still a lot of people that don't know that there's physiotherapy available for pelvic health concerns and have never heard of physiotherapy for pelvic health. So that is what we're going to talk about today. So today I'm here to give you some education about what our role is as pelvic health physiotherapists, as well as some basic pelvic health information, and also some tips for what you can do today for sustainable pelvic health for now and also through the lifespan. So a pelvic health physiotherapist is really just a physiotherapist who has special training to assess, diagnose, and treat pelvic health conditions. So some of these conditions might include symptoms during pregnancy, which could be everything from pubic symphysis pain to sciatic pain, to vulvar varicosities, also labor and delivery preparation, and also preparing for that 4th trimester season. Postpartum healing, return to exercise after vaginal or cesarean delivery, as well as urinary and or fecal incontinence or other voiding dysfunctions. So that might look like the inability to empty well, chronic constipation, maybe frequency. So feeling like you're going all the time, or overactive bladder, those types of symptoms. Pelvic organ prolapse, chronic constipation, or even IBS symptoms, as well as pelvic pain conditions. That could include interstitial cystitis, painful bladder syndrome, endometriosis is a huge part of our care, vaginismus, or other types of vulvar or vaginal pain, or pain with intercourse, and chronic hip pain and or low back pain. We also see women who are perimenopausal, moving through menopause and postmenopausal, and genitourinary symptoms of menopause, as well as pediatric voiding concerns and dysfunction. So that encompasses a lot of things, and really women throughout the life. So right from kiddos all the way through postmenopausal. So what exactly is the pelvic floor? So I am going to show you my pelvic floor here so that you guys can get a visual of what this actually is. Here we are. So everything you're looking at here is the pelvic floor. I'm going to give you the other view as well. Okay, so there's 3 layers of muscles that make up the pelvic floor. So this is layer 1. Layer 2 is kind of on the flip side of that. And layer 3, which is kind of the big powerhouse of the pelvic floor, is on the inside part of the pelvis. So there are 4 big functions of the pelvic floor. So the first is what we typically think of when we think about pelvic floor function, and that's for urinary and fecal continence. So controlling the stream, controlling emptying and filling, essentially. The second is to help support the pelvic organs. So inside the pelvic bowl, we have the bladder, the rectum, as well as the uterus and vagina. So the pelvic floor works to ensure that those organs stay inside the pelvis. The third function of the pelvic floor is in sexual arousal and orgasm. And the fourth role of the pelvic floor is as a core muscle. So the pelvic floor works along with the diaphragm, the deep abdominal layer, which is called the transversus abdominis, and some muscles at the back called the multifidi. So together they make up the core. We kind of have this idea of what the core is, but what actually is that core that does all of those really core-y functions are really those 4 muscles. So when we think about pelvic floors, there's really a spectrum of pelvic floors. So on one end of the spectrum would be a pelvic floor that we might typically think of when we think of people with pelvic floor issues. So this would be those that have a weak pelvic floor, maybe low tone, not great support, not very good strength. Symptoms of people with this type of pelvic floor might include leaking, maybe prolapse, maybe difficulty with orgasm, and just this overall feeling of just not feeling really strong. On the other end of the pelvic floor spectrum is a pelvic floor that's actually too tight. So this means that the pelvic floor muscles are almost always semi-engaged, and they're resting in this lifted high position most of the time. Symptoms of women that have a tight or a hypertonic pelvic floor might include leaking, perhaps prolapse, perhaps difficulty with arousal and orgasm. Sounds familiar, right? So women can have the exact same symptoms, but for very different reasons. The one kind of big difference for women that might have more of a tight pelvic floor or tight pelvic floor issues is that they tend to have a little bit more in the way of pelvic pain. But both ends, so both types can leak, both can prolapse, and both really need care. But the treatment is going to look really, really different. So I think this is a great time to mention that not everyone should do Kegels. Kegels have been kind of the cure-all you know, the most common recommendation for any type of pelvic floor issue, but it's really important to note that Kegels are not for everyone. This is where your friendly pelvic floor physiotherapist will come in to really assess where are you on this pelvic floor spectrum and are Kegels appropriate. Women that tend to be on this, the tight end of the pelvic floor spectrum, Kegels really aren't for them. What we need to do instead is encourage movement and mobility and teach how to help those pelvic floor muscles to let go so that they're available for support and available for control. So what can you do today to help with your pelvic floor health? Remember earlier I said that the pelvic floor really works as a part of the core system. This is important because the pelvic floor doesn't work alone. We used to think that, you know, they were kind of, it was its own muscle group, it worked in isolation and all you had to do was Kegels. But now we know that the way you set up the rest of your body and what's going on in the rest of your body dramatically affects the function of your pelvic floor. So when we're looking to improve pelvic floor function, we really need to look at the rest of the body as well. So despite where you might be on this pelvic floor spectrum, there are a couple big things that everyone can do to help with their pelvic floor. We know from the literature, from the research, and from the research that there are two big things that affect the ability for our pelvic floor to be able to work on our behalf or not. Those two big things are proper alignment, so posture. I know it sounds lame, but hang with me, stay with me, because it's not as bad as you think. And the second thing is how you breathe. So if we take a peek at, take a peek at this pelvic floor system, like I said before, it looks kind of like a canister or a core canister. I'm just going to adjust my screen a little bit here. The top part of the canister is your diaphragm. The bottom part of the canister is your pelvic floor. And around the outside of the canister is your transversus abdominis. So movement and things that move well usually work well. So if we can get that whole area and that whole canister working well, the pelvic floor is going to be in an optimal position to work well as well. So first thing that you can do today to improve your pelvic floor health is think soft. Like I said, things that move well, work well. So if you can soften your tummy and soften your jaw, and it allows some room and some space for that diaphragm to be able to move. And it also changes the pressure mechanism of our body that often leads to pelvic floor tension and or leaking. So this pressure mechanism, if we're always walking around with our tummy muscles engaged, kind of gripping around, and if we really think about it, many of us are like this, then it's kind of this gripping around our abdomen. That gripping or that abdomen is kind of like a balloon that's inflated. So if you take hands around the balloon and you squeeze your hands around this balloon, what happens to the balloon? We end up with this downward bulging or this downward pressure in the balloon. And the same thing is true for the pelvic floor. So first thing you can do is let go. So I'm going to get everyone that's watching just to take a second and let's try that. So let's let go of your jaw, shoulders, belly, soft, and pelvic floor or bum unclenched. Okay. This is a way that we can just rebel against the myth that women need to be tight all the time and have flat stomachs all the time. Things actually work best if we can let them. So step one, let go. Second thing that you can do to help with your pelvic health today is to learn to belly breathe. With our tummies relaxed, it really makes room for the diaphragm to be able to move. So the diaphragm, remember, is the top part of the core canister and the pelvic floor is the bottom. So the diaphragm drives the movement of your pelvic floor. So as you inhale, the diaphragm actually gently moves downward and the pelvic floor also moves downward. Again, things that move well work well. So if we can have good movement of our pelvic floor, it's going to be much more available to lift when we need it to lift and to let go when we need it to let go, i.e. when you're voiding. So let's try this now. So with your belly soft, your bum soft, I want you to take your own hands, put it around your lower ribs, or even you can give yourself a bit of a hug and try and inhale through your nose into your belly. And then exhale. As you inhale, see if you can feel a little bit of give between your sit bones. I'm going to give you a second to try that again. Inhale. The diaphragm drives the movement of the pelvic floor. Third thing that you can do to help with pelvic floor function right off the bat is to address alignment. So like I said, I know no one likes to talk about posture, but it actually matters. The position, we know from the research that if we can put our body into a certain position, we know that the pelvic floor is more active for us. This position is really a next step from what I've already said, so soft, belly breathe. The position that I want you to think about being in is soft, but proud, but open. The pelvic position affects how the pelvic floor muscles are able to really work. So we'll try this here in real time too. If you're sitting right now, I want you to think about sitting proud or sitting on your sit bones. Okay, so kind of rolling up onto your sit bones. If you're standing, you can do this by thinking about untucking your bum. Again, good posture or good alignment shouldn't feel rigid, it shouldn't feel militant, and it shouldn't begin just in our chest. We talk a lot about opening our chest as a way to kind of attain good posture, but good alignment is actually begins in the pelvis. So if we can think about untucking our pelvis and just opening gently through the front body, that position is a great position for your pelvic floor to be able to work. So we'll do a little experiment here. I want you to kind of, if you're sitting right now, sit back onto your tailbone, or maybe that kind of more slouchy position that we often find ourselves in. And I want you to try and do a Kegel here. So when you do a Kegel, I'll walk you through this real quick. Think about winking your anus, closing the labia, and lifting up a little bit. Okay, so try and do that in this kind of slouchy, not awesome position. Now I want you to roll up onto your sit bones. So the sit bones are just where, they're the sit bones where most of the pressure lies when you're sitting, okay? Or if you're standing, think about untucking your pelvis, and now try and do a Kegel. And let go. Easier, right? That position really helps the pelvic floor to be active on our behalf, even when we're not intentionally trying to engage the pelvic floor. So those are 3 things that you can take away from today. Think soft, belly breathe, the diaphragm drives the movement of the pelvic floor. And the third thing, walk soft and proud. The 4th thing you can do is to see a pelvic health physiotherapist, especially if you're having any of the symptoms that I talked about earlier on in my talk. There are so many, this I feel like just kind of brushed the surface of what education and information is available around pelvic health. There are so many other tips, so many other exercises, and so many other conditions that I know many women deal with every day. If you have questions, I'd love to chat. You can contact us either at the clinic, so Elle Pelvic Health, or Elle Physiotherapy and Pelvic Health. We have an Instagram page as well as a Facebook page with a lot of educational content. You can always email or call, and we can address any questions that you have. So thank you so much for your time.
All right. Thank you, Nicole. It was very interesting. And I just hope that women will take advantage of knowing that there is actual dedicated physiotherapy clinic in Red Deer who can look after them from the beginning to the end. I didn't know that for sure. Well, thank you.
Yeah, you're welcome.
Our next speaker is not going to be with us in person, but Dr. Bilston with the recording. And Dr. Bilston has been a family physician here in Red Deer for 18 years and has an interest in preventative healthcare and osteoporosis. She sends her apologies that she is unable to be with us tonight, but has pre-recorded her talk for us, which I will now play.
Hello everybody, and thank you for attending tonight, and my apologies for not being with you in person. My name is Anne Bilston, and I'm a family physician here in Red Deer. I'm going to talk very briefly about our bones and what we can do to help keep them healthy and strong to reduce the risk of osteoporosis developing in later life. This is important as strong bones are necessary for good health and quality of life. So let's start with the basics. What do we know about our bones? Well, bones are like most of our other tissues. They are living and constantly changing. It is a natural and continuous process in our bodies that old bone is removed and replaced with new bone. Most bones are of a similar basic design. They can easily be imagined as a matrix of a fibrous protein called collagen. This forms approximately 85 to 90% of a bone and provides the bone with shock absorption and resilience as it is pliable. However, if this was the only substance present, the bones would be bendy, rather like rubber. To give a bone strength and rigidity, minerals, in particular calcium and phosphate, are embedded in this matrix of collagen. This can be referred to as the bone mineral density. The greater the mineral density of our bone, the more calcium and phosphate is present, the stronger they become, and thus the less likely they are to break. Throughout childhood and adolescence, we build bone and deposit minerals in them as effectively as our bodies will allow. This process continues until our mid to late 20s, when we reach what is known as our peak bone density. After this, in a healthy individual, the body will continue to replace as much bone as it removes, thus keeping the status quo for approximately another 10 years. However, somewhere between our mid-30s and early 40s, the loss of bone becomes greater than the amount which is formed, and the bones slowly and silently become thinner and thus weaker. So, what is osteoporosis and why is it important? Well, osteoporosis is the end result of this gradual loss of bone mass. It occurs when too much of the calcium and phosphate has been lost from the bone. It is usually completely asymptomatic, the affected person being totally unaware of its presence until a bone is broken, or maybe a scan is done. The force required to break osteoporotic bones is very low. They are therefore called low-impact or fragility fractures, and can occur during everyday activities. The commonest sites affected are the wrists, hips, and spine. In some individuals, compression fractures in the upper spine can be missed as they are painless, the only sign being the end result of a hunched back. The unpleasant truth is that all these fragility fractures are not just a minor inconvenience. They can be associated with permanent disability, loss of independence, and unfortunately, early mortality. Neither are they isolated incidents, as having one fragility fracture increases the risk of having another. To quote Tumé Sozin and his co-authors from their paper in the European Journal of Rheumatology, every fracture is a sign of another impending one. So how common is osteoporosis? That is a good question with a very unpleasant answer. According to Dr. Sozin's paper, it is estimated worldwide that more than 200 million people are currently suffering from osteoporosis. And it is estimated, according to statistics from the International Osteoporosis Foundation, worldwide, 1 in 3 women over the age of 50 years and 1 in 5 men will experience osteoporotic fractures in their lifetime. He points out that with an ageing population and longer lifespan, osteoporosis is increasingly becoming a global epidemic. This brings us to our next question. What are some of the risk factors for primary osteoporosis? And when I say primary, I mean the osteoporosis that occurs in healthy people as they age, compared to secondary osteoporosis, where bone loss results from specific underlying medical disorders and is beyond the scope of this talk. As you can see from the slide, these risk factors can be divided into 2 groups. The first is considered to be fixed or unchangeable, for example, family history, gender, Caucasian or Asian populations, advancing age and small body frame, and unfortunately, there is nothing we can do about these. The other type of risk factors are known as changeable because, as the name implies, they are not fixed. They are our habits, such as our eating poorly, smoking, excessive alcohol intake, and sedentary lifestyle, which, with a little bit of awareness, can be changed for the better. The goal being to increase our peak bone mass when we are younger and then limit bone loss as we age. So let's go through this list and briefly review some of the ways in which we can help ourselves. Starting with nutrition, a diet rich in calcium and vitamin D is essential for good bone health. Dairy products in the form of milk, cheese, kefir and yogurt provide an excellent source of calcium. Other foods such as canned salmon, preferably with the bones, broccoli, kale and calcium-fortified drinks are good too. Ideally, we should consume 1200 milligrams of calcium in our food on a daily basis. This correlates to about 3 servings of dairy per day, 1 serving being approximately 30 grams of cheese or 250 ml of milk. Calcium supplements are not generally recommended unless the daily dietary intake of calcium is less than the recommended 1200 milligrams. I think it is also worth considering the absorption of calcium, as it is limited and decreases as we age, making it harder to get the calcium from our food to where it is needed for bone building. To help counteract this, it is preferable to consume calcium-rich foods at several meals rather than in one large serving. Absorption of calcium can also be affected by other foods which are eaten at the same time, including those which are high in phytic acid, for example beans, seeds, nuts and high-fibre whole grains, and food rich in oxalic acid such as spinach, rhubarb and sweet potatoes. The degree of these interactions is still under debate and so highlights the importance of consuming a balanced diet. Vitamin D can be considered as a companion vitamin to calcium, as your body needs it to absorb calcium properly. Vitamin D is absorbed by the gut and metabolized into biologically active vitamin D in the skin by sunshine. As a result, deficiency is common here in Canada as we spend such long periods of time wrapped up in winter clothes and living indoors. Taking vitamin D3, 1000 international units per day, is one recommendation. It is a fat-soluble vitamin, so needs fat for its absorption. Which brings me back to the importance of a balanced diet for optimal health, where all nutrient groups are eaten. Protein is a key nutrient in maintaining good bone and muscle health throughout life. As I mentioned earlier, collagen is the protein which provides the basic structure of our bones. Strong muscles are essential for our balance and helps prevent falls. It is recommended to consume some protein at most meals as part of a balanced diet. At this point, I think it is worth mentioning vegan diets and their potential effect on bone health. As far as I can see, the evidence is not clear and further research is necessary, but there is concern that a very restricted diet may make it difficult to obtain all nutrients necessary for healthy bones. In such cases, good planning of meals is recommended and help from a health professional should be sought. Vitamin C, vitamin K2, magnesium and zinc supplements have all been highlighted in the press for their role in osteoporosis prevention. Currently, there are no medical guidelines recommending them to be used in a supplement form. However, they are necessary, and so once again I stress the importance of taking a balanced diet to make sure they are all consumed. I'd like to give salt a specific mention now. This is because excess salt in our diet can wash calcium out of our body and contribute to bone loss. Limiting daily salt is therefore recommended, such as removing the salt shaker from the table and reading the labels on packaged food. Caffeine too should be consumed in moderation. As we all know, it is found in coffee, some energy drinks and colas, and to a lesser extent in tea. It decreases the absorption of calcium and can adversely affect bone health. What about alcohol? Well, we are all aware of the adverse effects too much alcohol can have on our bodies, and our bones are no exception. Calcium and bone metabolism is negatively impacted by alcohol. Health Canada recommends limiting alcoholic beverages to 2 standard drinks per day, with a maximum weekly total of 10 drinks in women, and 3 standard drinks per day with a weekly total of 15 for men. Smoking, as mentioned above, is another factor which adversely affects bone health and decreases bone mineral density. In view of this and the other health issues associated with nicotine use, it is recommended to reduce use and quit completely if possible. Now, let's think about how active we are, as a sedentary lifestyle can be a big risk factor for osteoporosis. I would really like to emphasise just how important regular exercise is for maintaining good bone health and strong muscles. All activity is to be encouraged, but in the case of bone health, it is important to note that weight-bearing exercise is needed to help bone mass, so walking, running, dancing, etc. are particularly recommended. Cycling and swimming, although good forms of exercise for cardio workouts, seem to be of little use in preventing bone loss. Generally speaking, the higher the impact of the exercise, the more likely it is to stimulate bone building and be of benefit. However, I add a note of warning for any older individuals who might be listening, is that low-impact exercise such as walking is recommended if bones are already weak, to prevent fractures from occurring. As always, a check with a health professional is advised before undertaking any form of new exercise. Muscle strengthening exercises using bands, light weights or one's own body weight should, if possible, be incorporated into any exercise program. Balance training can also be beneficial. Simply standing on one leg whilst performing simple tasks like cleaning your teeth can be a start if it is safe and appropriate. As for where to go for further information, I found the National Osteoporosis Foundation and Osteoporosis Canada to be 2 good resources. To conclude, I would like to stress how important healthy bones and muscles are for a full and active life. Understanding how peak bone mass is developed in youth and gradually lost after the age of 40 is important, as this knowledge should help us to make better lifestyle choices at the appropriate time in our lives. Such choices will translate into healthier bones and will minimise the potentially devastating long-term effects of this silent disease. Let's make life's journey an active and healthy one. Thank you for listening.
Well, thank you for those who stayed with us for the program, and I would like to thank everybody, all speakers today, for being there and talking about women's health, and I wish everybody a great day. Thank you.